Good afternoon and welcome to the Hawaii State Legislature for this Wednesday, March 9th, 2022, 1 p.m. joint briefing between the State Senate Committee on Health and the State House Committee on Pandemic and Disaster Preparedness to receive an update from the various county administrations and the Department of Health on the status of the pandemic. I'd like to thank you all for joining us. My name is Jarrett Kyohokalole. I'm chair of the Senate Health Committee. I'm also joined in the room by my fellow Health Committee member, Senator Kurt Favela behind me. And joining us shortly also will be fellow members of the Health Committee, Vice Chair Senator Rosalind Baker, Senator Sharon Moriwaki, and Senator Joy San Buenaventura. I'll turn it over to my co-chair from the House, Representative Ichiyama.
Thank you very much, Chair. Thanks so much for allowing us to join you in your conference room for this joint info briefing. On behalf of the House, is myself and Vice Chair Stacey Lynn Eli.
Okay, great. This informational briefing is being live streamed on YouTube. You can find links to a recording of this live stream on the state legislative website. And with that, let's begin the briefing. So first, we're going to have each of the counties do a quick presentation and update on the status of the pandemic and operations going forward on each of the islands. And we'll begin with the city and county of Honolulu. Thank you again for being with us, Mike.
Sure, thank you. Good afternoon to the committee chairs and committee members. This is Mike Formby, Managing Director, City and County of Honolulu, and I'm joined today by Krishna Jayaram. I think you all know Krishna. He's now the Deputy Managing Director of the city. And then Kevin Wong is here also in the office. And I did send over a one-pager, and I'm not sure if you guys have that. If I'm able to share my screen, I can put it up so we can talk to the one-pager, make it a lot easier to go through our status.
I think, why don't you keep going and we'll make sure that we can either get it to the members or give you access on the fly.
Okay, so I did want to cover 4 topics. One, current status of our City and County of Honolulu emergency proclamations. Our most recent emergency proclamation was 2022-01, and that's sunset on Saturday, March the 5th at 11:59 p.m. So basically March 6th, we no longer had an emergency proclamation. And that did include a sunset of our safe access Oahu policy, which I think you all know was mandatory vaccination or negative test at restaurants and other public forums. We also continue to comply with the governor's emergency proclamation through March the 25th, 2022, and that affects our employee policy on vaccination or testing. We had a different policy, but now we follow the state's policy through March 25th. And also we comply with the indoor mask mandate. As far as testing, I broke our current testing into 2 categories. One is city-sponsored testing, and we have 3 ongoing sites. DKI Airport, 7 days a week, we operate from 9 a.m. to 5 p.m. At Kapolei Hale, we operate on Wednesdays from 9 a.m. to 3 p.m. And at Honolulu Hale, we operate on Fridays from 9 a.m. to 3 p.m. And then we also have testing programs working with the Department of Health at the Blaisdell. We try to alternate days on these 3 sites. At the Blaisdell, we're Monday, Tuesday, Wednesday, and Sunday from 8 a.m. to 2 p.m. At the Waikiki Shell, we're Thursday, Friday, and Saturday from 8 a.m. to 2 p.m. And at Ka'iaka Bay Beach Park, Haleiwa, we're Monday, Friday, and Saturday from 8:30 a.m. to 3 p.m. As far as vaccinations, our programs have basically shut down. Right now we're standing up a city-sponsored mobile vaccination program. We're using ARPA funds to do that. And we're going to be using our Emergency Services Division mobile vehicles to go out into communities to try to encourage more people to get vaccinated if they're interested. So we'll be standing up that program pretty soon. And then the last thing I wanted to report on was isolation quarantine. We currently have 2 contracts. These contracts expire at the end of March 31st. The active one is at Harbor Arms. It's 30 rooms. As of today, we have 8 individuals in quarantine. One is being processed from Queens into quarantine today. And Westlock Modular, we did deactivate that facility. It had 22 rooms. It was expandable up to 50. It had 4 ADA rooms, which was the reason we had to activate Westlock. There was a request for ADA rooms, but it's currently deactivated, and that contract also expires at the end of March. So the plans are to just keep Harbor Arms activated through March, and then we'll close both of those facilities. So other than that, I have nothing to report about current status, but I do want to thank the state, the governor's office, the Department of Health, HIEMA. We had great coordination with the state, and we appreciate the help we got from the legislature as well. So unless you have questions, that's all I have to report.
If it's okay with you, Mike, I think I'd like all of the mayors to have the opportunity to go first, and then we'll open for some questions before we have the Department of Health come on.
Thank you, Chair.
Next, thank you very much. Next, we'll move to the County of Maui. Mayor Victorino, mahalo again for being with us.
Hello and good morning, and to all our senators and representatives online, I say mahalo to everything you've been doing to help us through this unprecedented times. My county, as of today, stands at an 18.18 case average per day. Over the past 7 days, our case count today was 20. Our cases have dropped down. The positivity rate has dropped to 3.3. And the county case trend has dropped more than 50% over the past 14 days. So all the trends are moving very well into what I call almost zero. And we're very pleased. Our hospital, they reported no cases of COVID-19 in our hospital this morning. So I think my county is doing well in that area. And I want to thank our representatives because, whether it was Sina Wildberger or Troy Hashimoto and Justin Woodson, Kaya Mashita, you name them, Roz Baker, as well as Gil Keith Agaran, and our new lady in the Senate, Miss DeCoit, Lynn DeCoit, thank you. I want all of them to be recognized, and also our others that I may have missed. Please, I want to say mahalo to you for everything you've been doing, not only on the island, but throughout the state. I have repealed the county emergency rules as of March 1st, 2020. Our bars and restaurants now are fully reopened and up to capacity and have noticed very little problems with this change. I've also mandated that I extended the outdoor dining directive to June 30th, 2020. Our safer outdoors still is in place, and the fact that people do not have to show IDs or negative tests, and also the vaccination cards. However, it is still safer to dine outdoors. So for all the restaurants in Maui County who don't have a permit for the areas that they may be using outdoors, they have up to June 30th, 2022 to attain a necessary permit to keep those areas outside of their restaurant that is not impeding public transportation or public access. They can, if they can show that their landlord has granted them, then we'll let that extend as far as their leases are concerned. We've also opened up accepting reservations to our county community centers as well as parks and recreation camping sites. Our community centers capacity 300 and under are the ones that are open up as of March 1st. Those are 300 or over will be opening up on April 1st. Again, we've seen very little impact as far as numbers, and lifting of these social gatherings, indoor and outdoors, brought a lot of hope and optimism to the county of Maui. I also want to thank the Department of Health because they have been integral in helping us throughout this pandemic. Our vaccination rate is 70% after stalling at 68% for several months. The Omicron surge did start and create a increase that was very well received. I believe by the time this is all said and done, we hope that Maui County will be somewhere about 75% overall fully vaccinated or have their vaccination series completed. Right now, we still have the hospital who offers on Mondays and Fridays the ability to get their booster shots and or their vaccination shots. Although counts have dropped, demand for testing still exists. We're still having some numbers as far as testing is concerned. Maui County continues to have free testing at Minute Medical Clinics in South and Central, as well as West Maui. And then also in South Maui, we have the pharmacy at Wailea. I also want to make sure that we understand that many of the pharmacists are still offering free shots in their facilities, in their stores throughout Maui County. I want to continue to thank all of them for their vigilance and their service to this community. With the announcement of the indoor mask mandate being dropped as of 11:59 p.m. for the state of Hawaii, Maui County stands ready to move in that area also. We've always wanted, and especially lately, having an optional mask wearing policy. So we will comply with the state dropping there and whatever other policies the safe travel and all of that. We're looking forward to those being dropped and having some normalcy in our way of life. This has been very positive for the economy. People are out there dining, people do a lot more shopping, and we see our residents who feel that this is what they've been looking for over 2 years. Again, I want to thank the administration, Governor Ige, and all of these people, Dr. Char and the Department of Health, for everything they've been doing throughout this pandemic. I will say this, working together with my fellow mayors and all our federal and state agencies, along with our county partners, has been a great privilege, and I'm very thankful. And I want to thank Mayor Kawakami, who's been a partner of mine since we began this COVID-19. And to everybody else, mahalo and thank you. And I hope I didn't make it too long, Jared. I apologize if I did.
Thank you very much, Mayor Victorino. Mayor Roth, please proceed. Thank you so much for being with us.
Thank you, members of the committee. I'm going to echo a lot of what was said by Honolulu and Maui. We dropped our county restrictions on February 28th. So we at this time have no county restrictions. We fall under the governor's mask mandates and the other requirements under the state. Our numbers have been trending lower as with everybody else. Today we had 8 confirmed cases. Our 7-day average is about 14.7. Positivity rate has been at 2.5. Our highest case count was on January 14th when we had 659. So that you can see that they're coming down quite nicely. We continue about 9 or 10 different opportunities for community testing a week. We're scheduled through March, and those will be reduced in April. Our vaccinations are currently being administered through our pharmacies, health clinics, and private providers. We want to take a few moments to thank, first of all, the community of the Big Island and really the whole state for really standing up. And Hawaii State, Hawaii County, we're all amongst the safest in the country. I want to echo the thanks that Mayor Victorino and Mr. Forsberry brought from Honolulu for all of our partners, the health department, the governor, especially the other mayors. We've met pretty much twice a week, sometimes even more, since I came in, and it's been really great being able to discuss. We have not always agreed with each other, but we've agreed to work together to get us where we are. I feel pretty good moving forward with this pandemic and moving it into an endemic. And I'm happy to answer questions. Don't want to take too much time. Thank you.
Thank you very much. And finally, Mayor Kawakami, thank you again for being with us as well.
Oh, thank you, chairs, vice chairs, members of the committee. Just very thankful to be here with you folks. I'm really here just to answer any questions that you folks may have in regards to our response. You know, we took a really aggressive defensive posture in what we would consider the first phase, which is pre-vaccine. We had set up some goals of population segments that we wanted to get fully vaccinated. And then we were going to take an aggressive approach to reopen our economy. You know, we really went through Delta and Omicron, and we've been dealt our fair share of case counts that were a little hair-raising at times, but we didn't layer on any additional restrictions because we felt we had taken a good approach during the first phase. And, you know, lo and behold, we were able to get through both surges with minimal restrictions. You know, we've only really had one rule in existence for a while, and that was in regards to large gatherings of 100 or more. And really what we did with that is started out as just a registration. So if you're going to have an event, you register your event, who's the point of contact, and then you read some guidelines and attest to that you read the guidelines and you're gonna try your best to adhere to them. And then it just became guidelines. And then we recently let all of those lapse and just dissolve. So it's been a pretty trippy ride, right? I mean, you're talking to a guy that used to call his mom when my daughter had the sniffles, and then we got to lead this community through a pandemic. But we're very fortunate and thankful to have had the support of the governor, my fellow mayors, HIEMA, our congressional delegation, our district health office really helped us, and just everybody that had to come together. And you know, in this regard, the legislature was very, very supportive, even though at times it was challenging just because we couldn't be in the same room and be a part of that same conversation. So just the way the communication flowed from time to time led to, I think, some confusion, but nothing that was insurmountable. But I think in a large part, our response is more or less the same as the other islands, maybe a little different in some areas, but I think we all had one goal in mind, you know, protect life safety, get the economy recovered, and then learn to coexist with a new virus. And I think we're on our way and we're doing a great job. Thank you.
Thank you very much. Members, questions for the mayors? Okay, I'll start, and I think maybe, well, really, I'd like to open this up to all of you or whoever's interested. The main question that will likely be asked of the Department of Health, you know, after they present later, is going to be what the plan is and what triggers they can make available for the community to keep in mind as we go forward, should there be a future surge of COVID, whether by, you know, this current variant or some variant into the future. Can each of you maybe share, as much as you're willing, how you're approaching any contingency plans that you might have in place to address future surge activity, and what specifically the legislature should keep in mind or be on the lookout for as you engage in those preparations? Mayor Roth.
This is Mayor Victorino, and since I'm the senior amongst all these guys today, sorry, Mitch, sorry. And I mean by age, I'm not talking by office. And thank you, Jared, for that question. You know, most of us have done and been through a number of surges and major surges. And could we have that in the future? It's always a possibility, but we've learned to be prepared. We know many indicators, and for Maui, we look at our hospital rates, we start looking at positivity rates. These are key indicators that we may be heading to some major challenge. We also look at the spread and where it's coming from. You know, most of the spread sometimes and will come from outside, whether it's our residents or visitors bringing it in. It comes from the outside. We're islands. And there's no way it can spread unless somebody goes outside of our world and picks it up and brings it home. And most of the community spread has been that way. So what I would ask the legislature to make sure is, number one, that we have contingency funds and plans that statewide will help the Department of Health meet some of the needs that come up. You know, needs like hospitalization, needs like the capability of bringing in traveling nurses and other kinds of FEMA help that is going to would be direly needed, like we had with the Omicron surge. But let's be ready for this and other areas where I believe we need to keep our vigilant on. In the meantime, we as counties have to set aside areas like you're talking about. We have our Site Q, which is a quarantine station. But we're going to have to move that because we're on state land and we're going to find another location. But having that available at every moment should it come back. And finally, I'll close with this. All of us have learned that we have to depend on ourselves first and the state second. I appreciate what the state has done, what the Department of Health and all the other agencies and their contributions. But we as counties have to be ready to take on whatever issues come and have immediate responses. And I think if you ask every mayor, they have a plan of action ready to go because we've now written the book on pandemic and we're much more prepared than we were 2 years ago. That's my response to you, Jared. I hope you understand what I'm trying to get to. Mahalo.
Thank you. Mayor Roth, did you want to add?
You know, I think well put, Mayor Victorino. I think we all have things. I'll just add a couple of things to that, though. And I don't know if General Hara is going to be presenting to you guys, but there is actually a statewide plan, and then we've all been working on individual plans. And one of the things that you've asked is something that we've been asking ourselves: what do we need to look at? We of course, as Mayor Victorino said, we're looking at hospitalizations, but we're also looking at things that may happen a little bit before then. For example, what's happening with our ambulances? Are we picking up a lot of people? And so I think everybody has been working on plans. What's good right now is I think the community has been conditioned, and I think that's allowed us to move forward. They know what to do, but we all do have separate kind of plans, as well as working together amongst all of our counties on the state plan. I see Dr. Char, Department of Health, also has some additional information. It's probably best for them to go over as well. So thank you.
Okay, members, any other questions? Chair Ichiyama.
Thank you. This is for all of the mayors. You know, now that we are, I guess you could say, in a relatively quiet place in this pandemic, I'd be very interested to hear from you if there are one or two lessons learned from your experiences, where as a state or, you know, for you as counties, that we could have done better or would have done differently.
I'll just jump in. You know, I think there's a lot of lessons that all of us learned. You know, we all started kind of building the plane while it was in the air. You know, no one really understood COVID when it first hit us, and we've learned so many lessons moving forward. You know, there was a lot of things that we thought we knew, and then the science came back and taught us some different things. I think the one thing that just good lessons moving forward is the last question that you had was, you know, what plans do you have moving forward? One of my favorite quotes is by Wayne Gretzky, the famous hockey player. He said, "A great hockey player doesn't skate to where the puck is, but where the puck is going to be." And so it's really good for us all to be looking at where we're going to be, you know, next month, or if something happens. And so having those meetings about who are the people that are getting the messages first. What happens, for example, when we lose the National Guard, who's been super helpful in everything we do. You know, they've been helpful on the vaccinations, they've been helpful on the testing, you know, test kits. There's been so many different little lessons that we've learned. And I think what we did really well was get together with all of us, the mayors and all the counties and the state agencies, having conversations, listening to each other and talking. The things that we wish we had, I don't know if we could have changed. We didn't know what we didn't know. We learned a lot as we went. So I don't know if that answers the question, but just some thoughts that I have.
Yeah, Chair Ichiyama, this is Mayor Kawakami. Great to see you folks again. I'd say, like what Mayor Roth said, I think there was a lesson to be learned around every corner in this pandemic. I mean, we were navigating a new situation. I would say that technology in and of itself is a tool. And like any tool, it can be very productive and it can be very destructive. You can either use a hammer to build or you can use a hammer to tear things apart. And I say this because one of the biggest challenges we were faced with was the amount of bad information and misinformation that was flooding the same channels of communication that we were dependent on. And I tell you, one of the disheartening things was, you know, when I was growing up, if you're out there spreading rumors, there was, I mean, you know, you're losing face in your own community. And in this day and age, it seems to be easier for people to get whatever it is that they want, whether it's verified, good or bad. And in this case, with severe consequences tied to that sort of misinformation getting out there, and how challenging that was. The second thing I learned is how important it is to already have established trust and to continue to build trust in your community, because the only way to, I guess, work against misinformation and bad information is if you have a base of your community that just knows you and that is going to compare what they're hearing, what's the source, and what he's saying. And we know this guy, he used to work at Big Save, he used to coach our kids. And in a large part, I think it was a good thing that Kauai is a rather smaller community because we all know each other. So there's, I think, a level of accountability if you're out there doing something you're not supposed to be doing in the community. But I'd say that like the big two is the importance of trust and being calm. And the other thing is, how do we address the misinformation that is out there that seems to be ever growing?
If I can kind of just tail onto that, that trust issue goes, you know, far between beyond government, but also in different community groups. We work a lot with the hospitality industry. We worked a lot with our businesses. And so one of the things that we learned was one size doesn't fit all. And, you know, for example, you know, the vaccinations may have been appropriate for Maui, and vaccination mandates may have been appropriate for Maui and for Honolulu. But for us, listening to our partners and people in the community, it could have been a death knell for a lot of those businesses. And so we didn't do the mandates. And I'm not saying that everybody shouldn't have done them, but for our island, it made sense not to do it. It may not have made the same amount of sense for Honolulu or for Maui. So I just want to throw that out as well.
Chair, thank you. Mayor Victorino had to step away for another meeting, but from Maui, and Sandy Bob's managing director, from Maui's standpoint, you know, we echo a lot of the conversations. What, you know, communication was really a real key factor in this. And, the level of support from HAIMA managing the incident and the governor in coordination with the other mayors really helped us to get through this, because it allowed us, as mentioned, we had daily meetings for quite a while, and it helped us to communicate different issues, things like that. One of the challenges we found is the silos that were in place prevented some of that communication, whether it was between state departments or between the county and the state, or sometimes within even county departments, or the healthcare industry, things like that. So we did have to break down a bunch of barriers, and people were hesitant in the beginning to communicate, but it did work out really well towards the end. And I think that I was just talking to Mayor Victorino, as we move forward, we're going to want to continue communication and continue, meeting with, say the healthcare industry on a regular basis, so we can keep track of these issues, find out what their deficiencies are, and what we can do as a community to approach and help those deficiencies and to relieve those. So, it really lessons learned. That's kind of big point from us. It was always a difficult balance between restrictions to prevent spread, the public safety and health piece of it, and the economic impact of that. And every single opportunity for a decision and path, do we move this way or that way, could have led to different situations in either one of those areas. And Mayor Victorino did side on the caution of health, sometimes more than the economic piece of it, but it seemed to bode for our community well. So even though we did have major spikes, we still did prevent a lot of unnecessary deaths and impact to our community that way as well. And where we could provide economic support, or as he mentioned, even the relief from some of the county codes related to outdoor dining and other things, we expedited permits for people who wanted to do expansions and create other dining areas and things like that. So it was always a balance, but it was really good to go through. And as he mentioned, we now have a better book of dealing with the pandemic. So thank you.
So Chair, on behalf of Honolulu and Mayor Blangiardi, I think we've had a couple of discussions, but I'll share that we agreed there was definitely a new level of collaboration and coordination, and we got better with it as time went by. But the improved lines of communication and how we learned to work closely with the governor's office, the Department of Health, who really had the expertise on the health side. We don't have a health services officer in Honolulu, so working with Dr. Char and her staff was really important. But I think establishing those improved lines of communication was a big win for the county. So we appreciate that. I think the biggest challenge for us is probably, and I think it's the same for the other counties and for the state, is really the funding and the economics of this, and where the funds come in. If they come in at the state level, do they get shared with the counties, or if they come in at the county level? And it shows itself. I'll give you one example: is standing up isolation quarantine facilities. Very expensive. And right now, for the 2 facilities we have, even owning those facilities, the contract services to run those is just very expensive. So when you get down to having 8 individuals occupying a facility, you're roughly paying something like $27,000 per room. And it's just a lot of money. So the funding has been a challenge, and I appreciate the help that we got from the state, but I think going forward, there's probably room for improvement on how to work out the funding, the sharing of funding.
Mayor Kawakami?
Yeah, I'm sorry, but like I said, I think Mayor Victorino and I have sort of been in this, like, it feels like our entire first term, and I would be remiss if I didn't say this, but one real big takeaway is, and I get it now, and I would be remiss if I didn't give a huge shout out to the Department of Health and all of our healthcare workers. I sat in the same conference room and went to the same budget that you folks are deliberating on right now. And seems like some of the departments, and I'll call a spade, but you know, Department of Health is, you know, like other departments, they're short funded. And, you know, I myself as a representative, I can say this with all honesty in my heart, have questioned what is it exactly that they do, right? I come from the grocery industry, so I view the Department of Health as somebody that's going to come in and inspect my, you know, Subway restaurants and my commercial kitchen and my reefers and freezers and see if the temperatures are being held at the correct temperature and giving me either a green, yellow, or a red card. But there's a greater understanding here on Kauai and appreciation for the Department of Health, our district health office, and all of our healthcare workers. And I will also say this, one thing that I personally learned is that as mayor, and you know, we started out, you know, as representatives pushing for the Safe Routes to School bill. Chair Ichiyama, you were a key player in that. And a lot of people couldn't understand why we were investing so much time in a built environment that was designed for people to move around and stay healthy and make healthy choices. But we get it now. If there's one thing I learned is where our vulnerabilities lie in regards to this type of disaster when we're dealing with a virus or any type of disease. It's usually those that have underlying health conditions or age that are going to get hit the hardest. And oftentimes when you take a look at it, who's impacted the most? It's minority groups. It's groups that are low to moderate income earners. And, you know, we just have to do a better job in our planning at the county level. We're making some strides. You know, before we used to hear, and I'm not going to say I'm for or against, I'm just going to say I get it now. When the Department of Health would propose a tax on sugary drinks and cigarette tax stamps, I'd always wonder, why are we doing this? I can tell you, understanding now this new type of disaster, where our vulnerabilities lie, I have a better grasp as to the mission of the Department of Health and the work that they do. And I will say there's a huge appreciation at the County of Kauai on the work that they do in day out. Dr. Berriman, you know, Lauren Guest, and of course, our entire team at the District Health Office on Kauai. Just, you know, we're indebted to them. So thank you.
Thank you very much for that. And on that note, I would like to again convey our appreciation to each of you directors and mayors for taking the time to come and meet with us on Zoom and present the status of life in the different counties. We really appreciate that, and we appreciate all of your work. So on that note, we'll move to the presentation of the Department of Health. And mayors and directors, you can feel free to stay on or get back to the things that you've been working on your islands. So mahalo again. I'd like to acknowledge, thank you very much. I'd like to acknowledge the presence of Senator San Buenaventura in the room as we queue up the Department of Health. Hello, Dr. Char and Dr. Kemble. Thank you for being with us. Please proceed when you're ready.
Hi, good afternoon. Thanks for the opportunity to share some updates on the COVID situation with everybody. I won't jinx it by saying that I'm not the only one that wishes that this would be the last one. But we appreciate the opportunity to kind of catch everybody up to what we're doing and where we're at, because I thought things would slow down a little bit, but if anything right now, we are scrambling faster than ever with things to do. So can I get the slides, please? With me today is Dr. Sarah Campbell, the state epidemiologist. So we're just going to try and kind of go over where we're at with regards to the global numbers and then look at the national numbers, what some of the planning and transition plans are for the nation, and then kind of zoom into Hawaii to see where we're at and what we're doing. Next slide, please. So this first slide, let's see if I can grab my notes here. This first slide shows the current numbers and trends. And if the top line in red, the bars in red, each bar represents a week. And so this is just looking from February 2020 to March 2022. And so you can see the spikes along the way. The second kind of little bump there right around April, that was when the UK variant hit. The next one that you see in August and September of this year was primarily Delta variant. And then the big stuff on the far right, where it says 2022, was the Omicron surge. And underneath it, the white lines represent the weekly numbers of deaths globally. And you can see that when the case counts went up, corresponding number of deaths went up tremendously. And you notice that on the far right, even though there was a much bigger red surge from Omicron, the weekly death counts didn't go up as high. And then the bottom graph is the weekly doses that were administered. So we're talking vaccination. So you can see that vaccination started right about 2021. And you can see the vaccinations that were done through the year and then now continuing on into 2022. So this is for the world. Right now, the world numbers are decreasing, thankfully. But what's still really concerning is that we're still seeing a spike going way up across Asia, specifically in China. South Korea is just off the charts. They've had about 3/4 of all the cases they've ever had of COVID have been in the past 28 days. And likewise for Malaysia, Vietnam, and some other areas in Asia. Japan has plateaued, but they're not coming down that fast. They're staying up about where their peak is, and ditto for Singapore. Much of Europe and the rest of the world is coming down. The US is coming down very nicely. So next slide, please. So this is the graph for the United States. It's the same curves. And so you can see that initial bump before 2021, I think that's UK variant. And then you can see the next bump between July and October, and that was the Delta surge, and then the Omicron surge at the far right. And you can see that across the US, the number of deaths that have been tied to each of the various surges, and the vaccination on the bottom. US right now, all the states are trending downwards. They're not all back down to baseline, but they are trending down quite nicely. Next graph, please. So this is Hawaii, and you can kind of see we didn't really get hit that hard by the previous variants until the Delta variant. And that's what you see in August, September, and into October, where we had a big surge in cases. And then compare that to the far right. That's what Omicron looks like in the state of Hawaii. Below that, the weekly deaths, and the graph for the vaccines kind of got jumbled up. I think when we switched over to HIR, it had been a little bit different prior to that. Next slide. So this is the epi curve for Hawaii that's listed on the Department of Health.d website. And it just kind of has the markers. You can sort of see what happened and when the various orders were issued. I think one of the things that's really interesting is that when we look at the Delta cases, you can see that bump right about August to October. There were 44,000 cases under that curve there, under that portion of the curve. And then you look over at Omicron, there were 3.5 times the number of cases in Omicron. So we had 150,000 cases in Omicron and about 44,000 in Delta. Interestingly, when you look at the number of deaths that are tied to those, so when Hawaii had that Delta surge, 44,000 cases, we had 347 deaths And when you look at the Omicron surge, much bigger spike. Thankfully, it wasn't as virulent, but we still had almost the same number of deaths. We still had 321 deaths. So that's a lot of our neighbors, our friends, our community that succumbed to the COVID variants. Can I get the next slide, please? So we looked at the national COVID plan. President Biden's plan was just updated and released last week. And really they're targeting 4 key goals. And that's what you see on the screen here. So the first one is probably the one that we've been working hardest on, and that's to protect against and treat COVID-19. It notes that vaccines are the best tool that we have to prevent hospitalizations and death. And then it gives some stats of, how many Americans are fully vaccinated. I think in Hawaii, we've done very well with the vaccines. 37% of our population is completely up to date on vaccines for COVID. 76% have received their 2 doses or their single dose of J&J and are fully vaccinated. 76% of our population. And then 83% of our population has received at least 1 dose, has at least initiated vaccination. We've given 2.8 million shots in Hawaii, and we're doing much better than many of the other states. And I think it's interesting to note that there are about 20 states that have not yet reached 60% vaccination. They're still in the 50 range for their population for fully vaccinated. And again, we're at 76 right now. So I think that's what's helped to protect us. We have been focusing on long-term care facilities, both residents and staff, to make sure that they're vaccinated and at least have access to vaccine to try and keep our numbers down, because we know that's a vulnerable population. And then we have provided many school-based clinics, hundreds of them, to get the vaccine out into the community and make it accessible to people in the community. And I think that's also helped keep our state safe. We've had clinics in areas that have high COVID rates, and that was a matter of equity and trying to provide access to everybody and make it easy for people to get vaccinated if they wanted to. And then we also did a lot of outreach and education to be able to answer questions for people so that they could make a good decision on whether or not to get vaccinated. The other thing that comes under this bucket of protect against and treat would include the therapeutics. And so I think most of us by now have heard of monoclonal antibodies and oral antiviral pills to help so that if you do get an infection, it's kind of like giving you a medicine that's sort of like borrowing an immune system to fight off the virus, or taking some medicine that kind of stops replication of the virus so that it doesn't get really severe. We have a good supply in Hawaii. We have done a good job with getting it out there. We haven't had as much need as some other states, I think, partly because of not having the tremendously high case counts that other states have had. But we have it. We're now getting it posted on the HTH website. It's all over the state. The third thing that's really important to us there is also testing. And the Biden plan is pushing hard for more access, free testing sites, free over-the-counter test kits, private and Medicaid insurance that now covers OTC test kits. And we just got word that Medicare will start covering as well sometime this spring. So a couple of important things there. You know how, I guess it was a month or 2 ago, they had free home test kits. You can order round 2 now. That as of today, if you go to covidtest.gov, it's really quick and easy. Go to covidtest.gov and you just type in your name and your home address, and you can get another set of test kits delivered to your house. And then also there's a means for insurance to either repay you or for you to be able to go in and get 8 tests per month that you shouldn't have to pay out of pocket for. And then the other missing piece was that Medicare wasn't covering it before, but sometime in the spring, they should start covering that as well. In Hawaii, we have done tens of thousands of tests per day during the surges. There's less demand now, thankfully, and we are transitioning and shifting to use more antigen tests and also more over-the-counter tests. We're trying to get those out specifically to areas that would have a hard time getting tested otherwise. So using it in certain communities where testing is a challenge. I think that's it for us for testing. There's a big push on the National White House plan for equity to make vaccines accessible, as well as testing and therapeutics, and lots of education and dedication of resources to make sure that there's equity in all aspects of COVID and beyond. I think we've done a pretty good job in Hawaii. We could always do a lot better, but I think we've done a darn good job trying to get COVID tests and treatments and vaccines and everything out to the entire population, and to try and help with, language translation or having people that were culturally more in tune with various communities, so that we were really providing equitable COVID response for communities. The second big box that you see here is preparing for new variants. The White House plan is looking for increased variant sequencing, meaning that they have the ability to do more sequencing, so that when a new variant pops up, we can identify it really quickly. In Hawaii, we've actually done a really good job with that. Our variant surveillance is being done via the state lab, but it's in partnership with a bunch of community labs. So if they get a positive COVID test that looks suspicious, they'll notify state lab and send the sample over there so that we can run sequencing on it. And I think we were one of a couple of states leading the number of sequencing, whole genomic sequencing that was done early on in the pandemic. We were able to identify Omicron really early, like by December 4th or something like that. We had identified Omicron in our state. That helps us in our response to know exactly where we stand. We continue to do surveillance for variants. I don't see that changing or going away at all. So we're being vigilant, and we're keeping our eyes open for if and when another variant should come to our shores. Also in the prepare for new variants, the White House is chasing a national wastewater surveillance system. And so we are also trying to ramp that up as quickly as we can. We are doing a small degree of that now, but we're hoping to really get that going full board, probably, I think it was by summer, or within the next couple of months is what I was hearing. The third box you see there is prevent economic and educational shutdowns. We're trying our best to be, to align with what the national guidance is. And I think we've actually, again, been ahead of this. We're really trying to keep kids in school and also keep workers safe at work by providing whatever resources and tools are needed to make that happen. In Hawaii, Dr. Kemble will address it a little bit more, but just the whole school guidance was updated recently. And then the fourth box is just to continue to vaccinate the world. The US has secured 1 billion doses to donate to countries around the world. And I think that, to us in Hawaii, sometimes that doesn't seem that significant or important. But as long as there are large pockets and communities that are not vaccinated, that's where you're going to see mutations in the virus. That's where you're going to see enough mutations that another variant gets created. And as we've seen time and again, it's only a matter of days or weeks before that variant can make its way to our shores and start spreading in our community. So it is important to be good global citizens and to make sure that the rest of the world is protected and vaccinated as well. I'm going to pass the next slide over to Dr. Kemble.
Thank you, Dr. Char. So along with all of these strategies nationally, there have been many shifts recently as well in approaches to the pandemic response. One area is for case investigation and contact tracing. So CDC updated their guidance in February to really shift to a framework of prioritized case investigation and contact tracing, prioritizing specific settings and groups that are at increased risk. These include congregate settings such as long-term care facilities, correctional facilities, and homeless shelters. It also includes unusual clusters of cases, especially if the transmission dynamics, the disease course, or the disease severity are concerning and not fully understood. So within these settings, we're looking at a system of prioritizing notification for those who are at risk of severe COVID-19. And this means moving away from the concept of universal case investigation and contact tracing, which are no longer recommended by the CDC for COVID-19. Next slide, please. So as we look at transitions, there are several key focus areas. These include vaccines, travel-related interventions like safe travels, schools, testing, hospitals, therapeutics, and public education. We're going to focus on a few of these areas to highlight. Next slide. I'm going to start by talking about schools. We've seen a lot of progress in the resources we've been able to make available to schools, and particularly for school testing and vaccination. These are just some quick statistics, but as of this point in the pandemic, since the beginning, we have at this point 196 schools actively testing for COVID-19 in schools, and a total of just over 100,000 tests conducted in public schools from August 1st to present, August 1st, 2021 to present. School-based vaccination clinics have also played a major role. We've had 795 school-based vaccination clinics from May 2021 up to present, and over 70,000 doses administered at school-based events. In terms of school guidance, we've just released updated guidance for schools yesterday. The key updates here are in the setting of universal masking, we're not going to require quarantine after exposure in a school setting. There's continued wearing of masks indoors, but masks are optional outdoors when we're at low community levels. Testing will remain really critical for schools. And we will be continuing in-school testing programs through the end of this school year, and also increasing use of home tests and distribution of home test kits to school-aged children and their families. Vaccination will remain critical. We are going to be seeing, as we look towards the younger populations, and if we do see approval of vaccine for under 5s, there will be an increased focus on enrolling pediatric providers and shifts from vaccinating in the school setting to clinical settings for those younger age groups. Communication is going to be really important to promote the importance of vaccination and remind people of what it is that vaccine provides in terms of protection to ourselves and to our community. Next slide. And this, to Dr. Jeff.
Yeah, I've been spending a lot of time on this FEMA funding recently, and I thought we have 100% FEMA reimbursement for for most of the vaccination and testing. That was great, and we should be completely compensated. And what I'm finding is that this is a gigantic project that every time we want to do a project for testing or for vaccination, there's a long process that we have to do to submit a request. We've been getting a lot of help from HIEMA because that's sort of the bridge to getting into the FEMA system, and also from budget and finance. But we write up a project, we submit it, and then FEMA has questions and they send it back, and we answer questions and we send it back to them. And a lot of this back and forth goes on for a bit. And then we get a little bit of the money fronted once the project gets accepted, but there's a long lag time. And so the other thing that was really difficult is that we were told that the FEMA funding would end as of October. And then I think it got extended to December 31st. And then we just heard it got extended to July 2020. But the problem for us is that we've been fronting all the money in general funds to pay for these projects, and it's all coming out of the Department of Health budget. So now we're scrambling to get money back to our programs so they can use it for the intended purposes for the fourth quarter. And so that's been a lot of work and a big challenge to make sure our programs have their monies back. And then we're still waiting for some of the FEMA funding, and we're trying to pay invoices on the order of millions of dollars. So that's been real challenging. And I'm learning more about this by the day. So it is a process. We're very, very grateful that we've had good support and that we've had this FEMA funding. But it's not as easy as I thought it was, and it's also taken a lot longer and a lot more work than I had appreciated at first.
Then talking about community testing and transitions here. One transition that was announced today, we are shifting from daily to weekly case reporting beginning today. So the next report will be next Wednesday for case counts and vaccine totals. And this comes in the setting of a lot of changes in testing that we're seeing right now, availability of testing, types of testing available. We're seeing a major shift to an increase in antigen, point of care, and home testing over PCR-based testing. So testing has both become more accessible and more within the realm of the common person to be able to decide when to test and what to do about their result. So this is really a shift towards increased education about what to do when you do test positive and how you can notify contacts around you. In terms of vaccination, vaccine for keiki 6 months to 4 years is expected in the next few months. We're still awaiting final data and then reviews by the FDA and the ACIP. We are reporting weekly vaccine uptake numbers beginning today as well. As of today, we have 543,414 individuals, or more than 5 in 10 among Hawaii residents who are up to date out of the eligible population. So those are people who've not just been vaccinated with the primary series, but also got their booster. And what's next? Our response will evolve as the pandemic evolves. We will be continuing surveillance for COVID-19, but we're looking at ways to make surveillance smarter and better. We're going to be monitoring for new variants, continuing, as Dr. Char was saying, with our sequencing efforts at the State Laboratories Division and with new technologies like wastewater testing. A major push is for data modernization. We really need to look at our existing information infrastructure and make sure it's ready and resilient to meet the demands of this and future pandemics. And we also are looking at easing of restrictions in the context of knowing that we have been following the trends and we are seeing cases come down, as well as hospitalizations and deaths. We are seeing the end upcoming of the statewide mask mandate, which the statewide indoor mask mandate in the current emergency proclamation will expire after March 25th, when the emergency proclamation ends. The state will be ready to reinstitute the mask policy if COVID case numbers surge. So masks are still a good idea for many people and in many settings. And these are some of the settings that we want to emphasize where masks are still going to be recommended. Indoors at schools, hospitals and healthcare facilities, as according to infection control guidance and standards, congregate living facilities, and that may include places like correctional facilities, shelters. Also, when you're going to public places that are crowded and where you don't know the vaccination status of other people. So crowded indoor events, masking may still be appropriate and is recommended. Also, for individuals who are immunocompromised, for our kapuna, and for those who are at high risk of severe outcomes, wearing a mask is still a really good choice. And people may choose to mask to protect those around them who suffer from conditions that might put them at greater risk. So we really want to emphasize to support others in the community, whatever their choices may be, and to respect their decision to continue to wear a mask.
I think in summary, it's just a reminder to everybody, we're in a good place right now. We're moving in the right direction. We have a little ways to go to get back to our pre-Delta baseline, but we're definitely moving in a good direction. Remember the basics. It worked thus far. It makes sense. The science absolutely supports it. Go get vaccinated. Vaccines work. Wash your hands often. Avoid crowded places, especially if it's indoors. Stay home if you are sick or if you're not feeling well. That's got to be a shift in our community. Whereas before, we all toughed it out, and unless your, arms were falling off or something, you went to work anyway. Stay home if you're sick and not feeling well. Whatever germs you have, I don't want them. So that's going to be a real shift for us going forward. And then go get tested if you get exposed to someone with COVID or if you aren't feeling well. And I think if we adhere to these preventive measures, that will really help to keep us moving in the right direction. So we're happy to take any questions. This is obviously a giant topic, and we're happy to answer any questions that we can.
Okay, thank you very much for that presentation. Members, any questions?
Yes, Chair, I do.
Senator San Buenaventura.
Okay, thank you. So a constituent who's been watching, first of all, wants to thank Department of Health for keeping the mask mandate in schools. She's very appreciative of that as a teacher, but she's concerned that with the scaling back of testing, both by the county and by the schools, whether or not you folks will be able to, I guess, track the variant sequencing. Do you folks have any plans regarding that?
But sequencing is going to remain a very high priority for the department, and we'll still be maintaining a high level of sequencing for those specimens from cases that we're receiving. And we continue to have cases, so I think we continue to have plenty of specimens to sequence. So I think that our visibility on sequencing will, in fact, in some ways go up, because we'll be sequencing a higher proportion of the cases that do happen and get reported to us. Now, as you point out, some of the testing, like home testing, wouldn't come for sequencing, but there are people who are still seeking testing in medical settings, and that does come to us. So that still gives us a very good sense of what's out there in terms of sequences. And some of the new technologies like wastewater testing will help us look for sequences that might not show up because it was a home test.
Just a short follow-up on that. So she wants to know when you folks are going to set up the wastewater surveillance, so that we can track this variant sequencing faster, sooner rather than later.
Some of that is already happening, and as Dr. Char was alluding to, we expect it to really ramp up in the next few months and to become an even more robust system. But we are already seeing some results from wastewater testing.
Yep.
Thank you very much.
If I could add to the answer for that. So the transition that we're in the process of right now, DOH pays for a whole bunch of testing sites in the community. And there's also programs in the schools and a bunch of others. So we are scaling back the testing that we do as we see the demand go down. But we want to make sure that people still have access to tests. And so we're kind of shifting people back towards how you normally would get tested if you thought you had the flu or something, back to the community. And that may be through your doctor, that may be through hospitals or some other clinics. Also, we're really encouraging people. There are free tests out there. Go to the the covidtest.gov website and order your free tests. You can go to retail stores and buy it, and then your insurance either reimburses or will pay for it up front, so you shouldn't have out-of-pocket costs for that. You can get 8 tests every month. There's all kind of stuff out there. And then additionally, the Department of Health is purchasing some over-the-counter test kits for areas that may not otherwise have access, that need a little bit more help to have access to testing.
The other thing I wanted to mention is that the in-school testing programs that are available now on the neighbor islands and Oahu are going to be maintained throughout the rest of the school year. So we actually saw a high peak in testing numbers in January during Omicron in our school testing programs. We have not seen that come down in February. So we actually are seeing still pretty increased uptake for testing in schools, and those programs remain available for in-school testing.
Okay, members, any other questions?
Thank you. I wanted to follow up on the wastewater testing. Can you explain how is that being done? Is it Department of Health? You're going out and collecting samples and then you take it back to the lab. What's the process for that?
That's being done through the state lab. So yes, through the Department of Health. And I'm not sure all of the logistics on how exactly it happens, but right now what we're doing is we obtain samples from every island from each of the counties, and then it's getting sent to the mainland right now to run the sample. But my understanding is that within the next couple of months, we should have the ability to run those samples on island. We're just testing out the system, and that's why we're sending the samples to the mainland right now.
Okay. And so how do those results get published or publicized? Or, I mean, it's not like you can count it as in your case count. How would you be able to share that information with the public?
So I don't know the answer to that yet. I'm sure we can figure out what would be a reasonable way to do that. Just as an example, so to give a better understanding. So a colleague in another state said that they're seeing their case counts come down from Omicron right now. So just like us, right, they're trending down. And they saw, I think it was an 11% decrease in the past couple of weeks. And then they also do wastewater sampling, and they've seen the wastewater sampling virus counts come down about 25%. So when they correlate the two of them, they know they're on track, that their overall test counts should continue dropping, because it's sort of like the wastewater is a even earlier predictor. So it's not in isolation, but using it in conjunction with other information you have. And it works the other way too. Before they saw the case counts go up, they started seeing an uptick in the wastewater counts. And so they were prepared, and sure enough, within a week or so, they saw their other test results go up. So I think it's a really good system when you pair it with other testing systems.
I absolutely agree. And I think, when you look at other states like California, they're using that as a part of their endemic model. And so I just would hope whenever you folks are ready to share with us how that information can be made publicly available, that would be very helpful. Thank you. Turn it back to the Senate.
Members, any other questions? Okay, I have a question. What do we need to, what are you looking at, and what would you need to see in order, in terms of disease activity, should there be another surge? Hopefully there isn't, but should there be another one, what do you need to see before you're in a position where you recommend to the governor that we need to take some of the similar actions that we've taken in the past to mitigate the disease activity? Like, for example, the mask mandate or any other type of action?
I think it's hard to answer in some ways, and yet it's not a specific number. If you look at the new CDC guidance, it takes a more global approach. And so the new CDC guidance has categories of low, medium, or high, and it's based now on hospital admissions. It's based on the percentage of people in the hospital that have COVID. And then knowing that hospitalizations are a lagging indicator, it also takes into account right up front case counts per 100,000 population. So if over a week you start seeing that go up, it should kind of pique your interest and put you on guard. And then you watch very carefully on hospital numbers. But I think it goes beyond that. It really needs to be tailored to the communities. So we're going to be going to weekly reporting, but I think we probably have a little bit better sense just from all the work that we're doing. And so it's going to be watching case counts go up. It's going to be watching the community response to that. It's going to be things like the wastewater surveillance and seeing that trend up. It's going to be following the CDC guidance and moving from a green category to a yellow medium category. I think it'll be a combination of things, but primarily it would be case counts, hospital numbers, new admission numbers, as well as, looking at the schools. Are we seeing outbreaks anywhere? And then kind of taking the pulse of the community as a whole.
I think it also depends on what we're learning about any new variants that emerge. So we often in this pandemic have learned from other areas of the world that have seen a variant before it gets to us. and we see what the patterns are in that area. So it would be different having a new variant where, okay, we're not seeing a bunch of hospitalizations where it's emerging versus a variant where you're seeing 90% of people end up in the hospital. That would be a really different level of concern.
So, as a follow-up, it looks like, from my understanding, the CDC is now sort of put in place in some ways, the color tiers that the counties had at a certain point in the pandemic, and that we've asked for really from the beginning. The follow-up question is, seeing as how your administration has pretty consistently been more aggressive in response to the pandemic and more conservative in terms of loosening restrictions, are the CDC guidelines a viable, are those viable indicators for the community in Hawaii to be monitoring should there be another surge? Do we look to the CDC guidelines first, or are there going to be additional specific triggers in Hawaii that you can apprise us of should activity start to rise again and the potential for, future mandates be something that might be pursued?
I think it's a combination. The CDC guidance has 3 general categories, right, for low, medium, and high. But if you look at the medium category, there's guidance in there that says things like, wear masks if you are at high risk. And it also says that we should strongly consider wearing masks if we're around others who are high risk. And if you look at our population in the state, we have really high rates of diabetes, heart disease, all those things that fall into that high risk category. We have a lot of our population that actually meets that criteria. So I think that's partly why, it behooves us to be cautious. So we will be watching the CDC guidance, and we will also be looking at, total case counts and again, what's going on in the rest of the community. I think Sarah raised a really good point, though, is that just the case counts alone or just the hospitalizations, we need to look at what's the variant, what are we dealing with in terms of the virus? Because if it's something that's quite virulent and really makes people very sick, we would probably be acting when the numbers are not as high. If it's something that seems to not make people as sick, then maybe we can tolerate a higher number and more disease in the community. So it really depends on the characteristics of the virus as well.
Mayor Kawakami?
Yeah, Chair, and I think I don't mean to butt in, but when the question gets raised as far as what are next steps if we do see another surge, I would be remiss if I didn't step up to the plate and say that if there's going to be a call to be made at the County of Kauai, ultimately it's going to be me pushing the button, right? The Department of Health and the District Health Office really serves as a partner and a guide. And I will be completely honest, what makes our team work here on Kauai is that whole incident management sort of team that is put together to respond to different disasters. And in regard to this disaster, our district health officer was one of 2 unified commanders. But ultimately, at the end of the day, we didn't always completely agree 100% of the time. But that's where the beauty of the process comes in, because you have different perspectives. And it's a very tricky question because we've evolved so far, right? I mean, at the beginning, Kauai had curfews because our firefighters didn't even have like rubber gloves. Doctors and nurses were reusing masks. I mean, we were making masks out of T-shirts. We had to show up to work and have our bus drivers figure out ways to get customers on board safely. And, the testing capacity at the very beginning compared to where we are at now is like a drop in the bucket. And, we can only be very optimistic that as we have all evolved, the science and technology has also evolved, and hopefully one day, right, like anything else, we hope to be able to have some over-the-counter medication to help take the edge off the most serious of symptoms in regards to this virus. You know, I've mentioned to my team that leadership and any sort of response and even running your own household is an art and a science. And really, the Department of Health is providing me with the science, but on my end, and I see it their way. And the beauty is they get to see it my way, because when I'm out in there in our community, once I get the feeling that a big portion of our community has become acclimated and has themselves sort of learned how to coexist with this virus, to throw in additional restrictions could jeopardize our whole ability to sort of guide our people for the long haul. You get what I'm saying, right? Like if a lot of people have really taken our guidance, they know when to wear their masks, they have gone out to get vaccinated and gone out to get boosted, and in their mind, they're all doing their little part. It makes it challenging to respond in the way that we responded during the first phase. I can tell you we'd be ready because there is a level of uncertainty of what lies ahead, right? We don't know what Mother Nature is going to do, and it is Mother Nature that we're dealing with. But I will say that we do have a good toolbox full of tools, but putting together all of these things requires that art and science. And you know, the Department of Health has done a wonderful job. CDC has done the best job that they possibly could do. But at the end of the day, it's going to boil down to oftentimes elected officials. And I think what worked for the state of Hawaii is like everything else, we don't always agree, but we look at low-hanging fruit and we pick off the low-hanging fruit to move on. And I think our response has been fairly successful. And you know, now we're focused also on supporting our businesses as they, you know, start to have some sort of economic recovery.
Thank you, Mayor.
Thank
I
you.
do have a follow-up off of that comment, but I'd like to open it up to other members if there are any other questions. Okay, so thank you for that answer, Mayor, because it goes to this question about the triggers. You know, the governor has mentioned the hesitancy with, and then I think Director Char, you also have mentioned the hesitancy with removing the mandates too early for fear that they will be difficult to implement going forward. You know, in reference to the mayor's comments, now that the last of the major restrictions and mandates on the state side are expiring, if there is future disease activity, will those decisions be left exclusively to the counties? There was a intentional move by the administration over the course of the pandemic to cede authority for implementing some of the mandates and restrictions to the counties. Is this the last we will hear of the governor initiating statewide restrictions as it relates to the pandemic?
Well, you know, I'm kind of echoing what Mayor Kawakami's sentiment was, and I think, you know, as he noted, the Department of Health just provides guidance. We're not the policy makers, so we would provide guidance. And also, as he notes, I think we've learned so much and we have evolved along with this virus that what we did early on may not be something that we need or want to do going forward. I think the governor is reserving that possibility, but I think going forward, it really is a matter of how best do we serve the community and keep people safe. And I don't think it's, you know, the same more draconian measures that we had to implement early on when we didn't know about this virus and we didn't have the science and we didn't have any way to treat it or prevent it. So I think now that we do have medications to help treat it, we do have vaccination, we have a myriad of testing options. I think all of that has made this a very, very different climate.
So I appreciate that, and I guess we've probably gone as far as we can go in that, except that I would hope that if disease activity does return to the level where some action is needed, and that I would hope that the department and the mayors would be willing to come back and provide communication, hopefully proactively before measures need to be taken, so that the community does have an understanding of who's pressing the buttons and when they should expect that they, are pressed. And so with that, I think maybe I'll stop there. And thank you very much all for joining us. And we thank the counties, but I would like to take a second and express my appreciation to you, Dr. Char and Dr. Kemble, and all of your staff for the work of the last 2 years. Especially in DOCTI, there has not been a lot of praise given it's by me especially, but by the legislature generally, to the long hours and heavy criticism that has been levied on the Department of Health throughout this pandemic. And I do truly appreciate the work that everyone in the Department of Health has done the entire time to keep us as safe as we have been, which I think has been among the safest places in the world in terms of case counts and deaths. And it really is a result of much of the hard work of you and your staff. So thank you very much again, and thank you for being with us. And on that note, we are adjourned.
Thank you, Chair.